Hi, everyone, and thank you for tuning in. We're so excited to bring you an amazing lineup of thinkers and speakers today, and a conversation about a really critical question, which is how do we design health systems in pursuit of health rather than just treatment and cure of disease? So my name is Ivana Gazabara, and I am the host of today's conversation. And in my day today, I lead the Future Center, which is a participatory digital platform for tracking trends and signals of change, making sense of what's emerging, and also building communities to drive positive change across key sustainability challenges. For today's conversation, around how we design health systems, maintain health versus treat disease, I'm joined by three amazing thinkers, each of who approaches this question from quite a different angle through their work. So I'm going to let each of them introduce themselves and say a few words about their work. And also they all got a small bit of homework ahead of this conversation, which was to choose an image which to them personally exemplifies the health system of the future. So I'm also going to ask each of you to share your image when you introduce yourselves and tell us a little bit about why that particular image spoke to you. So Amanda, can I hand over to you first?
Thank you so much, Ivana. My name is Amanda Janoo. I'm the Knowledge and Policy Lead for the Wellbeing Economy Alliance, or WEALL. WEALL is an organization of NGOs, governments, activists, and change makers from all over the world that are committed to transforming our economic system so it works in service of people and planet. And so in line with that, I'm very excited to join this discussion today, because a lot of our work thinks about how do we stop dealing with symptoms of the economic system like climate change or inequality or mental health, and really get to the root of the ways in which we produce and provide for one another in a way that is regenerative and fair and just. And so with that, I chose this picture sort of represent the future of health, as I'm an optimist. So I thought that this is quite a lovely community scene of people living in harmony together, engaging with one another, supporting and providing for one another in a way that seems to be fostering a lot of happiness, community connection, and health. So that's my image.
Nice one. Okay, can I ask you to go next?
Sure. My name is Dr. Balkrishna K. I'm more commonly known as BK. I'm working as Director Innovations with a nonprofit startup called as Leapfrog to Value. We are focused on bringing value-based healthcare to low and middle income countries. And I'm quite excited to be part of this conversation. I'm by education, I'm a medical doctor and an MBA. I chose this image because it felt like healthcare has to start before people become patients. It has to be a proactive step that is towards positive well-being, and it has to start with the community. So this image represented community to me. And I believe, like, if the mountain doesn't come to Muhammad, the Muhammad has to go to the mountain, right? And we should be able to segregate the jobs that the healthcare system does for people. And not all of them, these jobs are required to be in the facility. And 99% of time people spend would be in the community, not in the health facility. And hence, community-oriented care would be ideal to have. That's why I chose this image.
Brilliant. I like that actually none of these so far are sort of super high tech. That's interesting, isn't it? When we think about the future, because often they are like that. Walzi, over to you.
Thank you so much. My name is Walzi M, and I'm the Strategic Partnerships and Health Lead for Africa at the Rockefeller Foundation. So at the Rockefeller Foundation, not only are we currently supporting the COVID response, but we're also working on precision public health, which is an extension of precision medicine. So now in the health portion of my role, I provide technical guidance on project development, implementation, and evaluation. Now, the image I've chosen is of a roundabout, and it's very different from what everyone else has chosen, but there are 3 reasons why I've chosen this. So first, my vision for health or health systems of the future are health systems that are anticipatory, connected, and continuous. So I'll break those down probably later on in the discussion. But a lot of these, a lot of what I'm saying really draws from a book that I'm currently reading by Shantanu Nandi called COVID, Care After COVID. So now why I'm looking for health systems that are anticipatory, connected, and continuous are for 3 reasons. So when you get into a roundabout, you're not using retrospective data to figure out when you get into the roundabout. You look at what's happening right now, current data, and then you anticipate when you can get into the roundabout. That's what we need to be doing with care. We cannot be using retrospective data to inform care and healthcare in general. The second one is connected. And why I say connected is if you look at this picture of the roundabout, there are 16 lanes that it's connecting to. So there are 2 portions to this. Health right now works in a silo. And if we are to look at health holistically and focus on health versus treatment and care, we need to connect to education, we need to connect to agriculture, and a lot of the social or a lot of the determinants of health. The second bit is connection in terms of other healthcare providers. I think right now health is very intermittent and people work again in silos. So you have your nurses doing their things, the doctors, the pharmacists, the nutritionists. All of those need to be saying the same story and speaking to each other, much in the same way that the different lanes in the roundabout all work together. And then the last one is continuous. A roundabout is a sign of continuous traffic flows. So in a nutshell, this is the image that I've selected that represents my vision for the future of health.
Amazing. Thank you so much. I'll be looking forward to getting into that a bit more in the discussion. And I definitely want to kick that off ASAP. But before I do, I just want to cover off a few logistics points about how we're going to run things today. So the first thing I want to introduce is the 3 Horizons framework, which is the framework that we're going to use to structure the conversation today, but quite loosely. So essentially, it's a framework for thinking about the future and also thinking about transformation. And it's premised, as the name suggests, on 3 horizons, which are playing out at the same time today, but each also contains seeds of the future. So in this case, on the framework, the x-axis tracks time and the y-axis tracks prevalence. So the first horizon describes the status quo. So the current context and conditions of today, our working assumptions, essentially our kind of dominant paradigm. And necessarily not all of the ideas and practices and concepts on the first horizon are fit for the future. And so that's why you see that line curve down as time goes on, because some of those are going to sort of fade away. So the first horizon is what's dominant today, but a lot of it will kind of decline across a longer term time period. The third horizon, and I'm jumping around a bit now, but it'll be clear in a second why. The third horizon describes the future that we want. So that's our kind of visioning horizon. The seeds of that future are very much present and visible today, and it's what we often describe as new trends and emerging innovations. These are the sorts of things that might be kind of weak signals of the future right now, but if they grow and they mainstream, they can come to form a new paradigm. In the future, therefore, the third horizon replaces the first horizon. Perhaps the most interesting horizon for us today is the second horizon, which is kind of the space of disruptive innovation, of new ways of doing and being, and a space of change. So it's a kind of bridge between Horizon 1 and our present, and our vision and our preferred future of Horizon 3. So I just wanted to kind of say a few words about that because we're going to structure our conversation today along the horizons. We're going to first be on Horizon 1 and then 3 and then 2. And the second thing to mention is just briefly this Miro board that you're seeing right now up on the screen. So this is just our kind of online whiteboard, and we're using it as part of the project. Each time we're going to host one of these dialogues, we're going to capture the insights across the 3 horizons, and we're going to build it up almost kind of like a living map of our conversations. We're going to share that on the Future Center so that everyone can kind of see it as it develops, but equally so that all of our audiences tuning into the conversation can comment and layer additional insight into it through our discussion boards. So it's also kind of participatory tool for us for ideas exchange. Now, without any further ado, I want to kind of take us straight to the first horizon. So remember, this is our present status quo, the business as usual of today. And I guess given our topic of as the old saying goes, prevention is better than cure. My first question would be, what is the dominant way of doing things today in our healthcare systems? What is our business as usual? And maybe actually, Balkrishna, because of your work at Leapfrog to Value and that being about transforming today's healthcare systems, I'd like to hear your kind of diagnosis of this.
Sure. So today's healthcare systems are essentially driven by volume. And when I say that, basically volume of things such as number of procedures delivered, number of people immunized, and so on. So essentially, the metrics that we track today in our health system are volume metrics. We're definitely not against volume, because volume is required in the system, and it's required for many reasons. It's required for access, it's required for economies of scale, becoming better at something, you require volumes. But what we are against, or what the whole value-based system is against, is essentially being volume-driven. So if the entire health system is motivated by more and more healthcare delivery volumes rather than producing health outcomes, that's where the health systems are currently going wrong. And we see it in many ways, right? So essentially, for example, in emerging markets, when governments think about putting up more capacity out there, creating more health out there, what they do is they set up more hospitals. Because that's the metric that health systems are tracking worldwide. I mean, how many hospitals beds do you have? And on the private health side, what happens is the driver is obviously revenue, and the revenue is driven by the length of stay. It is driven by how many beds can you get occupied, and hence that's what drives private sector. So these are the things that are currently driving the health systems, and we would like to see a state where it is driven by value, which is essentially better health outcomes for everyone, and it's not necessarily within the health system, so to say.
Great, thank you. So driven by volume. Anybody want to come in on that? Anything else that sparks for you?
So if I could just jump in, since we're on the topic of metrics and using volume, I guess, as a metric, I think this goes back to one of the earlier things I said a few moments ago about how the data that we use is very retrospective. So, I mean, data by its nature is retrospective, right? So if you look at community health workers, for example, they are assigned to go to X district because last month people in this district failed to meet XYZ indicators. But that's not the way we should be using data right now. We should really be saying, okay, in this district, we know there are 10 women who are pregnant, 5 of them had prior preeclampsia. This is what we need to be looking out for going forward. So I guess really the takeaway for me is what's not working is the use of data in a retrospective manner. I think there are many predictive analytics tools that are available to us, and we really need to leverage them at this point in time.
Great, thank you. And is there anything particular that you're, just to sort of dig into that a bit more, that you're observing through your work with the Rockefeller Foundation that's specific to community health? Are there sort of things that are sort of, I guess, hampering community health delivery that are related to data specifically?
So yes, there are quite a few things. I guess the biggest one that I would point to, and perhaps this isn't tied, it's just a function of how community health work operates and donor funds. So I think one of the things I've noted is donor funds dictate where community health workers go. And again, it's based on retrospective data. So if a donor says, I want to train 1,000 community health workers to target women between 16 and 32 in sexual reproductive health, a lot of that is based on retrospective data, right? But we're not actually looking ahead and saying, okay, but what are the challenges that are coming up that we need to address? And what are the actual ages that we need to be addressing? Is it really the 16 to 32-year-olds, or is there another demographic? So I'd say that's one of the challenges, not necessarily from the work that we're doing at the foundation, but just things I've seen in general in the CHW space.
Can I pop in as well?
Go for it.
Yeah, so just around, I mean, this is probably a bit way more basic, but thinking sort of about the current setup of the health system, it seems to me that a lot of it is really focused on just trying to keep people alive, right? As opposed to helping people to thrive. So it really waits until there is an issue and there is some sort of health crisis, and then it focuses on, okay, well, how do we treat that issue? As opposed to, I think, what Walzi M was saying, additionally, that leads to a very siloed approach where you focus on the specific illness or issue, and then you become very specialized, not only focus on the individual, first of all, and their health, as opposed to the collective maybe health, but then even within the individual, it's about your heart or your lungs or whatever. And then the more specialized you get, you stop to see sort of the whole and maybe the ecosystem that has contributed to those issues in the first place. And so you end up with people who are alive, but not necessarily living a very good quality of life for a long time.
And if I can just add to that, my apologies for jumping in. I think the key takeaway there is that healthcare right now is disjointed. It's disjointed in the way in which healthcare providers speak to each other, and it's disjointed in the way that we even approach it. So right now, people go into the healthcare system when they're ill. Sometimes it's at random, sometimes it's scheduled, but there's no continuity in terms of when people should be seen, either by a doctor or by a community health worker. So that issue of disjointed care definitely needs to be addressed going forward.
Thank you. And no, please keep jumping in. That is exactly what I'd like. Amanda, I just want to pick up on something with you also. So you obviously kind of work within the wider economic structural context as well. How would you situate the healthcare system in the context of the wider economy today? How would you describe the way they interrelate and function?
Yeah, well, I mean, I think they're inextricably linked, right? So to me, I think one of the really important things once we get to speaking about vision, right, is about this reorientation, which Balkrishna was talking about as well, around, you know, what is the purpose of kind of the economic system? And so right now we focus a lot on viewing it as the purpose of it is to generate wealth, right, as opposed to well-being. And that being a really fundamental disconnect between means and ends. And so what that's led to is the healthcare system being viewed in many ways similarly as a means, right? By which we are focused on sort of, in the US, for example, generating more wealth, or in a lot of countries, it's become part of itself, a sort of economic machine, as opposed to thinking about, all right, what's important for our collective well-being now and for generations to come, and what are the kind of systems and ways in which we produce and provide things that are going to be in line with that. And so sort of becoming a little bit more ambitious, I think, in terms of the ways in which we are approaching these issues, and also really taking seriously systems thinking and looking at integration of these various areas, and being, I think, honest as well, that I think we've also fallen into a belief for a long time that if we just generated enough wealth, then that would solve all of our issues, right? And everybody would be healthy and happy. And that's what I think the Wellbeing economy movement is illustrating, is that particularly in very high income countries, they've built systems that are very good at generating wealth, and people are not happy or healthy, right? And so this is sort of a crisis and reckoning of a lot of the fundamental assumptions of the ways in which we've built these systems and what they're being oriented to support. So yeah, those are some of the reflections.
And I think you really see that kind of dichotomy right now with COVID, don't you? Where actually, you know, loads of countries are saying, oh, we're opening back up now because we need to really get our economy back on track. And it sort of feels like one or the other. And in fact, that might be a false dichotomy, because of all the obvious stuff of
Absolutely.
how do you have a healthy economy without a healthy populace?
Absolutely. I mean, one of the things I say all the time is just we are the economy, right? I think that gets lost on us a lot of the time because it's viewed as this very abstract, boring thing. And I think often the most important and influential things become really boring and abstract, so people don't engage in the conversation as much as they should do, right? But of course, the economy is struggling if we're struggling, right? And of course, the economy slows if we are not moving, right? Like, I mean, all of these things obviously make sense because, yeah, it is us. And we are it, and so we have the power to change it.
And so this, we've dived into some of the dysfunctions of our health systems today. To look on the more positive side, are there things that you think are working really well today that we should sort of strive to keep or build on?
Can I take that? Yeah. So I think there are a couple of things that are working really well for health systems. So one piece is new products and technologies, which offer much better longevity, reduced side effects. There is much higher quality of life as compared to what it was in the past. I mean, if you compare it to 20 to 30 years back, we are at a much better state. So just to give some examples, tuberculosis, we have a new regime which is 4 months now, which was much difficult back in, let's say, 10 years back, it was much difficult. The HIV regimes have improved drastically over the last 30 years. If we talk about cancer, I think 15 to 20 years back, breast cancer was almost a death sentence for people. Today, with targeted therapies, people can live up to like 15, 20 years. We talk about, mortality in terms of 15 to 20 years mortality now. We've also seen very rapid response times, right? So for example, with the COVID crisis, the tests for COVID were developed within a matter of days, and vaccine was developed in a matter of months. And this is unprecedented, right? I mean, this has never happened before. These definitely are record times by any standards, if you look at like even 10 years back. So I think on technology and product side, there are a lot of innovations coming in, and it is getting more and more rapid as well. The curve is steepening, as we can say. I think we've also made progress on the access side, quite a bit of progress on the access side. Of course, it's not a challenge that you can solve 100%. And as we go closer to 100%, the challenge gets more and more difficult because you're now trying to reach more difficult to reach populations and so on. So I would say we have made significant progress on that front. And even on the data systems side, at least in areas of public health importance, we have basic data that's getting captured. And I think it's thanks to years of investments from multilateral funders, private foundations, and so on. At least a basic data system or data structure is available. As Walzi said, basically it may not be used properly currently, or we may not have all the indicators that we would want in terms of tracking the right indicators, but at least a structure is available now.
If I can just give some perspectives from the African continent side. So I'd say what is definitely working, what we should keep. And all of this really is a function of the pandemic right now. It's been I guess these are the silver linings, if we can call them that. So the first one is the investment in political will into the health systems on the continent. And this is specifically to community health. I think the pandemic has made a lot of people realize that community health workers are the backbone of Africa's health systems. So that'll be the first one. The second one I would say is development of a lot of new, not innovations per se, but solutions that have been on the table for a long time, but have never been actioned. So the first one is the pooled procurement system known as the Africa Medical Supplies Platform. That has been one of the biggest wins of COVID, if we can call it a win, but it is a win. And the second one is plans to take vaccine production in-house on the continent. So whereas we've been importing all our vaccines, now there are actually concrete plans for that development to happen on the continent. So I would say those are the things that have really changed that we should keep in terms of health systems.
Can I add to that? I mean, one trend that I would add to that is telehealth. Telehealth has been around for years together, decades together actually, but never really picked up. But with COVID, the willingness to engage on telehealth platforms has improved quite a bit on patient side as well as on the doctor side. So I think that is one area that has benefited from COVID.
Totally. I cannot remember the last time I've actually been to see a doctor. But the thing I have wondered about is like, is there a kind of a split there? Because obviously there's a chunk of the population that's going to be kind of tech savvy and have access to those platforms. Is there a layer of the population that's kind of left behind with this leap around telehealth?
Yes, absolutely. I think there is definitely a dichotomy there. But I think the penetration of technology, at least telephone technology, has improved quite a bit over years. Today, even in rural India, people have smartphones, cheap ones, but they would have smartphones. And I know in Africa, that would look quite different, and sometimes people will have basic phones. But telehealth doesn't have to be in isolation. It can be even, a community health worker having access to a telehealth portal and the community accessing the telehealth through that portal. So even that is a hybrid model that's possible.
So if I can just add to that perhaps. So yes, while telehealth may not be available to everyone on the continent, there are other solutions which leverage that technology and mobile phone penetration. So one of them, I guess, would be mHealth solutions. So a solution that really stands out to me is the use of GPRS printers. So in a lot of countries, early infant diagnosis is required for children or infants who are exposed to HIV before birth. And I'll give the example of Zimbabwe. In Zimbabwe, before we adopted the use of GPRS printers, it could take up to 2 weeks for a mother to find out if her child was HIV positive. With the introduction of GPRS printers, that turnaround time went down to 2 days because now you get your results in real time. So while things like telemedicine may not be accessible, we do have solutions that are leveraging the use of mobile phones.
Okay, I'm going to slowly start to move us into the visioning space because I feel like we're heading there already. Any final words about our status quo?
I would add one more thing on culture, because I think at least the medical community tends to be very, very hierarchical, driven by institutional norms and stuff like that. It's also in some ways close-minded. I'm myself a doctor, so I can say this, that basically for any intervention, even if it is, let's say, a supply chain intervention, a doctor would always ask, is there evidence? Is there a RCT done on this? Which sometimes comes in adopting these innovations. So I think there is a bit of culture that needs to be addressed as well.
So you're saying it's almost a little bit too evidence driven in some situations.
Yes, sometimes it is too much. It's good in most situations, but in some situations it can come in the way of adopting innovation.
Got it.
I think final thing I'll sort of mention, and you both would know better than I, but in terms of, it seems that at least within the health community itself, there's a really strong awareness of the importance of more integrated health models. Now, how much that has actually transmitted into the general public or like within the larger policy space, I think it's still wanting, but health professionals recognize that our minds and our bodies and our souls are very interconnected, right? And so that recognition of the interplay between that is something that I think is being advocated for a lot more now, as opposed to treating mental health as its own separate sort of thing from bodily manifestations of potentially those phenomena, and then even recognizing increasing, the quality of our food and, the strength and trust in our institutions and in our communities, and how much all of those kind of larger societal phenomena also fundamentally impact our health as well. So Wilkinson and Pickett's book, like The Spirit Level, it looks at all of these various health outcomes as it relates to inequality and things like this. I think there's starting to be, a lot more advocacy within the health community for those intersections and looking at things as a whole, which is good.
So a more systemic take on things.
Mm-hmm.
Yeah, thank you. Okay, I'm going to invite you now to move over to the third horizon and do a bit of visioning with me. So this is really the key question here is, what is the future we want to bring about? And I feel like we're going there a bit already in talking about what's kind of working within the current system. What do we want to keep and grow? But what I want you to do now is kind of give me a more detailed look into what should the new health system paradigm be? What would be its kind of key hallmarks and characteristics?
If I can kick off with one thing, I think one of the really major things would be a fundamental recognition of the interconnections between human and environmental health. Yeah, so I think recognizing that we ourselves are a part of our natural environment and not looking at them as separate phenomena. So really looking at where are the aspects where we're seeing co-benefits for the environment and for people when we invest effort and innovation and support for fostering greater environmental regeneration and shifts in the ways in which we are, engaging with our ecosystem and plants and animals and our climate.
Absolutely.
Sorry.
Go ahead.
I was just going to say, if I can just build to that idea of connectedness. I think something that we need to push for more is connectedness between healthcare providers and patients. And this doesn't have to be anything radical like apps on a smartphone or anything like that. If we take the concept of DOS therapy for TB patients, where you have your community health workers going to the patient's home and actually watching them swallow the medicine, that's the kind of thing we need to do. I'm not saying everyone should be visited by a community health worker, but we need that level of constant interaction between healthcare systems and patients.
Just to build on that, basically, what you talked about in terms of connection, the connection between a healthcare worker and a patient or a person who is being treated, or a doctor and a patient, that connection has to be based on compassion. And there is an entire branch around compassionomics, which talks about this. And sometimes that compassion, we would expect that it would take a lot of time for people to build that compassion and actually show that in a conversation. But the studies around this really say that it really takes 40 seconds to actually ask, how are you feeling? And I am with you in this journey. I will take care of you during this journey. And just that adding that 40 seconds of script, literally a script, has shown to change clinical outcomes. So definitely I would advocate for more human connection within the health systems, or any interactions that happen between the health system and the patients or people. And obviously, it goes two ways. The patient also has to be compassionate about the doctor and the provider. That's one. The other thing that Amanda talked about in terms of the mind-body connection, I think definitely what is happening currently is we treat mental health as a separate topic, right? I mean, when I did my MBBS, essentially, we had one topic out of 22 subjects, which was psychiatry, right? And in psychiatry, we think about just the diseases which require medical attention. But there is a spectrum which is below that, right? And which is a huge spectrum, and people are still suffering from that spectrum. And that is completely ignored in medicine, at least in the traditional sense, it has been ignored. And it has been allocated out to a specialty called a psychiatry, right? So I would want that it becomes more integrated, not just on mental health side, but social health, mental health, spiritual health. All of these become integrated with the health system, and essentially, it's expanding the definition of health, but yeah, it's going beyond the traditional ways we have been treating health.
Absolutely. Yeah, if I can jump on that also, I do think that this, expansion of our understanding of health beyond the individual and beyond, just if you're sick or not, but really to collective well-being, and that becoming very much our metrics of societal success is the starting point, right? That it's not just like a subsect of society, it becomes really the aim in and of itself. And then the systems that we build, healthcare, right, is not just its own thing, it's really embedded within all of the ways in which we structure our economy, or the ways in which, like, the types of work we prioritize. So right now, for example, the majority of people in the US or the UK feel they're working in a job that it need not or should not exist, right? A job that is actively pointless or actually hurting other people in some way, or the planet. And that's really problematic, right? Because the majority of people want to be doing work that they feel like is meaningful and in service of other people or in our environment. And so if we swap that logic and we think about, okay, how do we actively encourage and reward the kinds of activities that are supportive of societal well-being, of ecological well-being, then everything is sort of oriented towards a broader understanding of, well-being and flourishing, which can be a lot more sustainable as well, as opposed to just generating the wealth and then using some of that to fix the damages that were done in the process, right? Which is always going to just continuously loop over and over and get worse as we destroy, and consolidate more wealth.
So I have to ask you, what are the measures of success for collective well-being?
Yeah, so I mean, a lot of different societies are taking different ones, right? But generally, I mean, there's the outcomes, right? So I think that there's always, obviously, health outcomes, there's educational outcomes, there's community trust. There's a lot of importance around participation. So people's ability to feel like they actually have a voice over the decisions that influence their lives. I think a really important area that we're seeing more integration into this is also values. Yeah, so values of, I think, as you're talking about, like, compassion, respect, solidarity, helpfulness, these sort of things, figuring out how to integrate those that are viewed as really important for our well-being. But I think ultimately, trust, but I think ultimately the most important thing, coming back to the participation, is that you're asking people that, right? What matters for your well-being, and that's their starting point for those discussions, and then using that as your metric of success, so people themselves feel like they are going to be the drivers and the part of achieving that vision.
And Walzi, so you've spoken about kind of the importance of precision care. What are the ways in which kind of tech and data supports an effective health outcomes focused system of the future?
Oh, glad you asked. So it really draws on one of the things I was talking about, data, right? And data being anticipatory. So if I can give an example from the Rockefeller Foundation. Prior to COVID, and actually currently right now as well, we're supporting community health workers so that they're digitized. And it's not just digitized so that they enter in data in real time, but it's also digitized so that they're able to, or on the back end, they're able to use a lot of the predictions to inform the work that they're going to do. So I would say that's definitely one of the ways in which we can leverage tech to ensure that health systems get to where they need to be in the spirit of precision public health.
Thank you. So this is jumping around a little bit, but policy, we haven't really kind of touched on that sphere yet very much. What are the right sorts of political frameworks in this vision of the future? The enabling kind of structures, I suppose.
I mean, one really sorry, you go, Walzi.
No, go ahead. I was just going to ask a clarifying question, but please go ahead.
No, you asked the clarifying question. Yeah, let's go down.
Okay, I just wanted to get a sense of if you can expand a little bit more on the question.
Well, simply if we're visioning a sort of a system where it's more about kind of prevention rather than cure, that's a health system that sits within a broader kind of well-being economy, what sorts of policies and political structures can enable that?
So maybe if I can just jump in quickly before Amanda comes in. So I'd say we definitely need cross-functional policies. I'm not sure if that's the right term, but we need policies that work across the different sectors: agriculture, education, health, finance, especially finance. They're the ones giving the resources. If you don't have the Ministry of Finance on board, you can have the best plan, but nothing will take off. So definitely we need more cross-functional integrated policies for health systems.
Just gonna sort of reflecting on COVID and the really, really dismal failure at multilateralism that has been occurring, I think that this is going to be one of those spaces where we're going to see huge innovations. It was what happened after the financial crisis as well. It's like people assumed after the global economic crisis, we would see massive reform, but it took a while. There was a hangover. And then it was like, okay, well, here's all this new thinking that's starting to come up around the way that we manage our economies. And similarly, I think we're going to reflect on this failure of our ability to recognize the global nature of this pandemic and effectively deal with one another and pretend like somehow national borders matter within this space and come up with really new innovative approaches. And I think a really good example of this is the G7 agreement that now has become a global agreement on, minimum corporate tax standards. And that's huge in terms of progress of recognizing that, health outcomes and our collective well-being needs to be universal, right? That there's a universality within humanity, and that we're not going to be able to deal with the major health crises of our time, which are going to increasingly be driven by climate change and extreme inequality, without dealing with that as a global community. And so I think some of those additional policies that we're going to be seeing is one, a lot more around trying to create enabling environments to reduce the consolidations of power and wealth globally. So right now, like obviously the minimum corporate tax standard helps to reduce some of the offshore banking and all of these things, but still almost every industry in the world is now controlled by less than 4 corporations. And that's just not going to be sustainable, right? So I think like global competition legislation, I think in terms of, patent reform, this is going to be huge. You cannot allow for these kind of patents to continue to go so that you have, I was reading an article the other day, and Walzi, you can correct me, but for every $1 that flows into the African continent as foreign direct investment, $3 immediately flow out. Like we have built a system of really strategic and consolidated sort of exploitation of money from poor communities, which leads to low health outcomes, more violence, inequality. And so ultimately, I think we'll end up seeing a lot more redistributions of wealth, but also systems of production that share wealth more, so cooperatives, circular economy initiatives, these kind of things that really get to the roots of what's harming sort of people and planet in these systems.
Well, Krishna, maybe before you jump in, I just have something very quick to say to that. And it's again around policies and enabling policies. So I think one thing that is missing and that will be critical is policies that enable not so much the last mile, but the bottom bit of societies. So this is community health workers. We know that they support our entire health system. We need enabling policies for community health workers. We also need enabling policies for grassroots organizations. I think what COVID has taught a lot of people is, if you go to informal settlements, for example, it's the grassroots communities that are supporting the COVID response. So definitely we need more policies targeted at the bottom than at the top.
So I was going to answer this question in slightly narrow window, because we've expanded the window on what health means and kind of talked about a lot of other things and how it is interconnected. I wanted to bring back to healthcare, the way we currently pay for healthcare. So essentially, the reason the entire system is volume driven is because we pay for volumes. We pay for every surgery that happens, every procedure that happens, every time the doctor visits you, every time you go visit the doctor, the health system gets paid, right? And hence, there is incentive for providing more and more services. So we need to change the way we pay for healthcare, right? Instead of paying for healthcare services, we need to start paying for health outcomes, right? And there are obviously many technicalities there in terms of, how do you standardize the data? How do you make sure that there are no confounders? How do you design the package and so on? But the way to do that is, capitated payments especially for services like primary care, community health care. It should be capitated payments. Or even for things like surgeries, there could be bundled payments around that, and making sure there is some guarantee that if there's something that goes wrong, the healthcare provider will take care of that. It's pretty much like a road contract, right? Where you don't just build the road, you also make sure that for next 5 years it is your responsibility to maintain the road, and then the quality of road automatically goes up because you know that you have to maintain that road for 5 years, right? Likewise, the quality in healthcare can go up if we get into a payment model where we tie the payment to outcomes rather than just a service. So I think that's one way it needs to change. It is changing in some ways already. So the Affordable Care Act in US, there are some other models that exist across US, across different LMICs. There are small startups which are doing this in a capitated payment model. But yes, I think payment is a hand that kind of shapes the entire system. It's almost invisible hand that shapes the entire system.
Yeah, I mean, I think it's a really important point. I mean, it's insane that you would make money off people being sick, right? But that's how we've sort of built the system. So I think it's a really, really good point. I mean, but coming back to your question, which is prevention, right, as well. I mean, water policy, agricultural policy, these things are going to be huge for health. They already are, right? So we're at a place where we have innovations, for example, in terms of regenerative agriculture, and more carbon capture through our agricultural systems, more small scale, sustainable sort of systems, and that becoming a lot more of the priority than I think, Balkrishna was talking in the beginning. I mean, we've been so focused on volume for so long, on economies of scale for so long, and believing that technology is going to solve all of our issues if we just, just keep innovating. And in many ways, I think we're going to come back to a realization that we need a lot more medium-sized things than fewer huge things. Yeah, like that's just going to end up needing to be sort of the solution we get to in some of these areas, and a lot more policy investment in cleaning our waters and regenerating our land to be healthy.
That links to Walzi's earlier point, doesn't it, about more cross-cutting policies and really needing to see that. And Mariana Mazzucato, for example, talks about kind of mission-driven policies, doesn't she? And this is kind of a similar sort of thing. So what are our big missions rather than what's our transport policy or what's our agri policy or whatever?
And I mean, I think related to that, in all honesty, I think it's less the policy than the way that we make policy. And I think that's what we're reckoning with right now. I mean, you'll see all over the world, there's huge amounts of government protests. There's a big breakdown in trust in government. And so I think alongside that, we're seeing a demand and the beginnings of a sort of democratic revolution, a demand for more participatory engagement in decision-making, which I think will come back to, as Walzi said, the need for more grassroots, localized power and decision-making. And so that us needing to really think about new innovative ways in which we make these policies, because they are still very top down. They come from really senior experts a lot of the time who then tell, whoever sort of mouthpiece minister that this is what's going to happen. And then the communities are implementing something they didn't have any engagement in crafting, and they don't really understand. And there's a disconnect in implementation all the time as a result.
Thank you. Now I want to move us on a little bit. This is really interesting. It's, we're kind of getting into the how a little bit, and that's what I want to unpick next. That's perhaps the trickiest bit, isn't it? The kind of, so how do you make that happen? And some really interesting things are coming out of the Third Horizon discussion that have really made me wonder. Like, we've spoken about compassion. That's fascinating. A kind of compassion-based healthcare system, about kind of treating in an integrated way spiritual health, social health, mental health, physical health. How do you do some of that stuff? So let's start with stuff that's already kind of incubating and happening, because maybe that's the kind of easiest starting point. Where are you seeing disruptions and innovations that you think are really important and are taking us towards our preferred horizon?
I think I talked about some of them earlier, but responding to what Amanda was saying earlier, there are some branches of science. One branch is basically One Health, which talks about integrating human health, animal health, and plant health together. It's still narrow; it's just health, but at least sees the interconnection between these three. The other branch of science that I thought was very interesting is something called as human flourishing. There is a program at Harvard, and essentially, right now we are working with one of those innovators to see how human flourishing can work in an environment of sickness. When people are at a hospital or actively in pain, how can human flourishing work in that environment? We're still struggling to answer that question, but we're starting work on that direction. And I think that could be another interesting branch of science to explore. Of course, there are a lot of small startups or small scale models that are in the right direction. I mentioned the Affordable Care Act. I think also the CMMI model in the US is also a right direction in terms of incubating various experiments in, which can be creating better outcomes at lower cost for people who are actively sick. Then there are, on the government side, I can give a few examples. One from India, which is basically the Ayushman Bharat program has a arm where they have a health and wellness centers being established. At least conceptually, it's going to address the well-being part for the community. Second is from South Africa, where in the province of Western Cape, they have a community-oriented primary care model. And they have a program called as WOW, Western Cape on Wellness, which is basically engaging community members and empowering them with the right knowledge so that they can become the advocates for NCDs health in community. So on the government side, I think these are the two examples that come to my mind. On the private side, there are a lot more examples actually. There are many disease-focused innovators. So Arvind Eye Care, for example, from India, which has actually taken high volume, high value approach, a frugal innovation, best in class outcomes across the world. That kind of innovation is happening, but it's all completely focused on one particular disease. It's not integrated, but definitely providing best in class outcomes in that area. So yeah, I think there are a lot of emerging examples across the world.
So if I can just share a few innovations, or the ones that come to mind, all have to do with the use of cell phone technology. So in Rwanda, for example, the government is using cell phone tower data to augment contact tracing efforts. So if we know someone was here, we use cell phone data to say, okay, which other people were in this area at the time? So that's one example of using cell phone tower data. The second is in Zimbabwe. So there is a project called Energize the Chain that's being run by Econet. And essentially when there's a power cut, because cell phone towers generate their own power, vaccines are taken from the various clinics around the cell phone tower and put in a refrigerator that has been installed at the base of the cell phone tower. So while these aren't like huge AI predictive analytics innovations, these are innovations that are actually making a change to just basic things like immunization rates. So I think those are the two that come to mind for me.
I love that. Cold storage is like a really, really meaningful issue, isn't it?
So I think my input is going to be a little more abstract. I don't know if that's that's helpful or not. I think one of the big shifts I feel like I'm seeing, and it's not necessarily that this is going to be the way that our paradigms do shift, but paradigms are shifting, right? And I think we're really clear that a lot of the pain we're experiencing right now of uncertainty around trust in conventional institutions and processes and even identities is making space for a big shift in the way we think about the world, and the way that we manage it and structure it. And the way I think about this is often that we're entering into the age of the feminine. So feminine, not in terms of women, but in terms of a reconceptualization of the kind of values and processes and ways that we're organizing things. So for a very long time, we focused and valued very logical, structured, linear methods of thinking and organizing and assessing things, very quantitative. And right now, even through this discussion, I think what we're seeing is a real recognition of the importance of more holistic, fluid, multidimensional conceptions of reality that don't maybe fit as well into those traditional sort of systems and ways of thinking, and that leading us to really try to consider and embrace more indigenous forms of wisdom and knowledge, trying the whole decolonization movement of really wanting to empower voices and perspectives that have historically been marginalized, and recognizing that there's fundamental, like, deep wisdom and knowledge to be found in those experiences, and then in those areas, and in some ways a recognition that we need to move from a fixation on growth to an achievement of balance, and that being sort of, I guess, what I mean when I say like the feminine, of trying to just rebalance those two things in the world, rebalance a lot of the things that we've thrown off balance through very narrow fixations on individualism, competitiveness, greed, etc. for a very long time, rationality.
And so what do we do? So there's almost, that space is opening up, as you say. What do we do to kind of spread and scale the seeds of that so that, we kind of get to the third horizon, if that makes sense?
Yeah, I mean, I think that this is where, I think all of us are probably taking different strategies to this. My organization, at least, we see the importance of collaboration. So the need for us to really connect across silos, across disciplines. So for me, this has been really fun because I don't come from a health background. So my ability to feel like I can contribute something to these discussions, right? And also learn so much from the others who have incredible knowledge and experience in this area, and bringing together a variety of movements and actors to work to build a new kind of power base and a new kind of way of thinking, in order to sort of advocate for these shifts. I also sort of mentioned, I believe a lot in the importance of participatory democracy. So I think the only way to really challenge power is to disperse power. Yeah, so the more that we are allowing for more people to have a say in these sort of decisions, the better. Because I think we'll end up with better outcomes in the end that are more inclusive.
So I'm going to answer that question in two parts. One is that every transformation kind of needs three things to work together. One is you need a strategy for that transformation. You need to know where you're going. That's the strategy piece. Then there is an element around culture, and then the third element around measurement. And all of these three have different roles to play at different stages of the transformation, right? And this is from Elizabeth Teisberg, Professor Elizabeth Teisberg of Harvard Business School. And this is part of the value-based healthcare transformation as well. But this framework kind of applies to any transformation, really. We need to know where we are going. We need a way to measure whether we are making progress, and we need a cultural shift in that direction, right? Because the current culture is definitely not working, and every change will come with a cultural shift. So I think those three have to be addressed in different ways. And in terms of how do we get there, we talk about this roadmap to getting to a transformed state. And the first step, in my opinion, has to be experimentation and being open to trying different models, allowing innovation coming from bottom up, and actually allowing people who are at the front line to innovate and come back and say, this is the problem that I'm trying to solve. This is how I'm trying to solve it. Give me ways to measure this, measure progress, and really trusting them with that innovation, right? And once we see that something is working, picking it up and then scaling it up, right? So that's in my way, in my sense, the way to kind of scale these innovations. You have to experiment with different things, and they could be radically different from each other, and still coexist with each other. And we have to pick up things that are actually taking us in the right direction.
I love that. And I think that the point you made about kind of frontline driving innovation, that's such an important point for community care, isn't it? Because that's exactly
Absolutely.
what we need to see more of in the kind of solutioning space.
One really good example of this, I like how you broke that down, Balkrishna, around like those areas, I mean, measurements. So I don't know if you know about the Wellbeing economy governments, but it's like it's an alliance of governments which are committed to a different notion of economic progress. And so it's New Zealand, Iceland, Wales, Finland, and Scotland right now. And so they've all developed new indicators to monitor national progress beyond just GDP, and to really try to engage communities and different sort of conceptions of well-being in developing those new measurements for a new vision, right? A new vision of progress. And so what they're doing is a different sort of form of multilateralism where they just meet and exchange and support one another to figure out how this works. So that's sort of experimentation as opposed to working as a block, as it were, in the international community. So that's like a high level sort of exciting example of this sort of shift.
Thank you. Walzi, do you want to come in with a final thought? Oh, you're on mute.
So maybe just I don't want to beat a dead horse. I know a lot of the thoughts I had have already been said, but I think really the way to take us to where we want to be is through the use of not just community health workers, but also empowering the people at the bottom. I think that's where you see a lot of change happening and a lot of very innovative responses or innovative solutions happening. So definitely empowering those at the bottom.
Thank you. And I know, so this is like the biggest question, isn't it? Like we could have this conversation for a whole day, but I'm afraid we are slowly running out of time. So I think I'll probably stop here. And I just want to give us a chance to kind of sum up and offer final reflections. I've loved the conversation, by the way, everything from kind of the diagnostic of volume-driven care models, a focus on keeping people alive, the healthcare system as a kind of means to an end, the things that are a bit disjointed and kind of broken at the moment, but also some of the things we want to steward through and keep, from kind of improvements in access to new products and technologies to, the rapid response teams and times that we've seen in the recent, during the recent COVID pandemic. And also I love this whole thing about the kind of the compassion that needs to be the base layer of the system, the recognition between human and environmental health, and the kind of integral connectivity between all the different sort of the mental health, the spiritual health, the physical health. I'm summing up just my own kind of highlights from the conversation. Any final reflections from the three of you?
I would say, I think we're just at a really critical juncture in light of the pandemic, and this is really our chance to reset the way in which health systems operate going forward.
Absolutely.
So from my side to add, basically, we need to expand the definition of health. And I mean, WHO has done a good job in defining health, but the way we deliver health is still focused on physical health. It's not counting quality of life. It's not counting the care experience that people have. So I think the moment we expand that definition, it goes beyond physical health. It goes beyond health itself also. It will go into social determinants of health. And I think that's where prevention can really happen. The prevention space is going to be on the social side, not on the health side, really.
I agree with everything that they've said as well. And I really hope it does end up leading to a big sort of reset and an expansion in our understandings of health. And I think I would just really call on the international community or anybody who's maybe watching to be kind and patient with themselves, because I think it's been a real struggle. Yeah, I think people are really struggling mentally or physically right now. And yeah, just take care of yourself and take care of others, and hopefully everything will be all right.
That's a great shout out. And that's the thing that's often forgotten as well, isn't it? Is the kind of the softer side of things. Well, thank you so much to all three of you for bringing such rich, such unique and fascinating insights into this conversation, and for just having the conversation. It's been great. I've had a lot of fun. And we are going to do this again next week, as you know, so do tune in. Next week's topic is, what should equitable health models look like in the digital age? So actually, Walzi, very much kind of along the theme that you've been raising throughout this conversation. So yeah, thank you again, and do tune in also to thefuturecenter.org to follow all the conversations. All right, I think that's a wrap, guys.
Thank you so much.
Thank you.